Would you suggest a patient with a negative antibody test after getting 2 injections need a booster dose with respect to vaccine?
Yes, it is and again, I'm not infectious disease trained, but it is my understanding that those antibody levels, we have not established a threshold to correlate with immunoprotectiveness. Because I know there's been a lot of kind of discussion among just anecdotally other physicians that I know, people doing home antibody testing and wondering if their own, their immunorecognition is waning because their home antibody test is negative. And again, the impression that I have is that we have not established a very firm cutoff to say that those definitively correlate with immunoprotectiveness. So I would use those with caution, but I am not an expert in this area by any means.
Some new information that's just coming out from the FDA in regards to potential authorizing a booster dose for the vaccines. I'm going to credit Dr. Evans for this, just that the FDA is potentially amending their EUA, or the emergency use authorization, that it would only pertain to immunocompromised patients who have already received their full dose of the Pfizer or Moderna vaccines, so the 2-dose regimen, that they would receive a booster dose. And I don't know if we have any data as to how far out from the initial 2-dose regimen that they would get the booster dose. So probably 6 months, 9 months, 12 months, we're not certain at this point in time, but that is just kind of like the hot news coming off of the press today. So thank you, Dr. Evans, for sharing that information. I had heard some information about that potentially happening, but hadn't seen anything official coming through from that yet. So